everyone, this is Dr. O'Connor. I hope you are doing well. And nowadays, that is a loaded question. I just hope everyone is doing as well as they possibly can be in the face of this international pandemic. We have over 120,000 cases of coronavirus in New York State. And collectively across the United States, we have more cases than any other country. Many of us have been furloughed, laid off, fired, and released from our places of duty without even knowing if these businesses will ever open. And many of us on the front lines are going to work each and every day, despite our fears for ourselves, our families, and doing what we do and what we're supposed to do every day. Many of us are homeschooling and attempting to homeschool our kids. Many of us are dealing with a full house, which was once an empty nest. And many of us are dealing with challenges that are too numerous to count. And I think it's safe to say that many of us are dealing with the upheaval and the upending of our daily lives. And when you're dealing with something like that, this high level of uncertainty, this high level of not knowing what's going on can bring about a lot of anxiety, and it can bring about a lot of fear. And then you start to become feeling powerless and defeated. There are some steps that you can take to bring back some normalcy and sanity to your life. First and foremost, knowledge is power. Knowing how this virus spreads, knowing the modes of transmission are key. We first heard that it was aerosolized, so coughing into your elbow or covering your cough were the modes that we were taught to do. But now we know that that virus is airborne, and it can be airborne for several hours. We also know that the virus can last on multiple surfaces for prolonged periods of time. It lasts on stainless steel for 72 hours. It lasts on glass for 96 hours. It lasts on plastic for 72 hours. It can last on cardboard for 24 hours. So it's important now to wear your mask at all times when you're outside. Make sure you avoid touching your nose, your mouth, your eyes, and your mucous membranes. Wash those hands before you touch objects, after you touch objects, before you eat. Just make sure hand washing for at least 20 to 30 seconds. Make sure you're wiping down those surfaces and disinfecting highly trafficked areas. Make sure you're staying away from people at least 6 feet, and studies have shown now we may even need more than 6 feet. And make sure you're staying away from those people who are sick visibly, because we don't know who's asymptomatic and who's not. So knowledge is key. Secondly, take a breath. Do it with me. Because this too shall pass. Realize it will end. And thirdly, many of us have time on our hands that we have never had in our entire adult lives. Make sure you do something constructive with that. If you're finding that you're living paycheck to paycheck, and many of us are, and we're patiently awaiting that stimulus check, then sit down with your family. Have that honest discussion. Make those tough decisions. Create a budget. And vow that you will never be in this situation again. And if what you can do now, if you have time off, check those car insurance rates. Check your home insurance, your life insurance, the credit card bills, the cable bills. See if you can negotiate a better rate. Hell, see if you can negotiate a deferral at this time. And if you find that you have some extra time on your hands, call that friend you've been meaning to call for the last 20 years. Take some time out, check in with long-distance relatives that you haven't spoken to in a while. Call grandma, call grandpa, make sure they learn how to Skype. Make sure they know how to Skype. Set up a Facebook account. Take the time now to stay connected. It's good for your mental health. Take some time, go tackle that closet that you've been putting off for a long time. Donate those clothes that you know you can't fit into. Or better yet, Resolve now to work out and exercise so you can fit into those clothes and get out when this pandemic is over. Clean out that junk drawer that you know we all have. Tackle those stacks and stacks and stacks of paper. Read that book that you've always wanted to read. Go through the kitchen, go through the cabinets, go through the cupboards. Throw out those spices that are 5 years old. Throw out all those dried goods that have expired. You can't go to the car wash? Grab your kids, get that bucket, get that soap, get that water. Wash your car yourself. Play board games, play Pictionary, get that spades tournament going. Make those meals that you never had the time to make. The key is that you need to create your new normal. You need to make sure that you try and get a new regimen. If you're used to getting up every single day and doing something every single day, and suddenly you can't do that anymore, that's when depression sits in. That's when we start to get depressed. So the most important thing is to create your new normal. Look at this and find the silver lining in the cloud, find the blessing in disguise, turn this catastrophe around so that when this does end, you will emerge stronger, healthier, and smarter. You'll be more fiscally fit, you'll be more spiritually grounded, you'll be more physically fit, and you'll have more of what you need so that when this does end, because it will, you can hit the ground running. Keep your mental health, keep your physical health, keep your sanity. And make sure to exercise as much as you possibly can, because that helps. This will end, but we need to be better for it. So if this message helps, please share it with your family, share it with your friends, share it with your colleagues, share it with your neighbors, share it. Make it go viral, because we need to take care of each other and we need to take care of ourselves. And we need to know that we can do this, we can get through it. So you can follow me on Twitter, you can like me on Facebook, I'm on Instagram, LinkedIn, YouTube, all the various forms of social media. So until the next time, be safe, be well, and be healthy.